Hi, good morning. We're continuing in the series of videos for parents with borderline children. And when we say children, we mean primarily adolescents and young adults, though, of course, many of these issues continue for parents throughout the child's early adulthood and even well into their 20s, 30s, and onwards. Um, I've been thinking about core topics for parents who are struggling in this area, and I frequently return to my book. And there's several chapters and issues that are in my YouTube channel, which more specifically deals directly with the book. And I think they have value in repeating them here. And if there's too much overlap, I apologize. But I think that they're so important that they deserve recognition in both YouTube channels. And what I'm going to talk about is a few issues today: psychic pain, the borderline child's poor sense of self preservation, and how the borderline child um, places himself in the victim position. In other words, throws a pity party. We'll talk about all these. And really, this is almost directly again from the book, but I think it's very important for these, for in this video series for parents. Um, I would just start by saying the most difficult part about having a child who is ill is the parent suffering with that illness. Now, I know that sounds awful. One would think that the real terrible part of it is the individual, the child's own illness and the child suffering. But there's no greater hardship for a parent than having to watch a child suffer with an illness, particularly when the parent feels helpless, and particularly when the diagnosis or ability to properly understand the progression of the illness is limited, and when supports and interventions are also perhaps modest. And this is particularly true for borderlines and even more so for borderline children, because there are so many difficulties with assessing and diagnosing, and hopefully we'll have a specific video on that for parents. Um, while pain often accompanies medical disease and physical injury, pain also accompanies and is a core part of psychiatric illness and psychological injury. Borderlines try to understand their life, and they often compare themselves to others who are not suffering in the same ways. And it becomes very painful for them to see their differences. I worked in a community program for individuals who had developmental and intellectual disabilities. And one of the most difficult groups within these homes were not the profoundly disabled, those with profound intellectual disabilities. It was those individuals whose intellectual disabilities were modest. In other words, those people with, let's say, 70 IQ level, because they had, or 75, whatever, they had sufficient wherewithal to properly compare themselves to children or even adults of the same age, and they could see their deficiencies. It's like in the general classroom setting. In the general classroom setting, you have kids that are A's and B's and C's and D's, and some kids that fail. There's not a lot of A's, and there are not a lot of F's. But the kids that are like in the D area in particular, or the consistently D plus, C minus, those kids are well aware of how poorly they're doing. And they're well aware that there are kids that are doing not just in the A level, but in the B level and generally getting the material. And they feel particularly stupid. They feel particularly badly about themselves because in comparing and contrasting themselves with others, they understand their own limitations. This is, by the way, what children and adolescents do, even to some extent adults. They compare and they contrast themselves to children of the same age, particularly peers and those in their classroom, as a means to understand themselves. Um, the psychic pain that your child will experience from this is also very new. In other words, it's not uncommon to see children with borderline personality disorder who do relatively well in their early years of development, but the main behavioral and emotional dysfunction emerges in middle to late adolescence. So they may have actually been functioning somewhat well academically, socially, within the family setting, undertaking community endeavors and so on, and then things slowly fall apart. While emotional pain pertains to hurt feelings, which is really damaged emotions, psychological pain pertains to something much more akin to brain pain. That is, neurological pain, which is the pain that we feel when we strain to process information, trying to make sense of the world. This is, by the way, the task of an adolescent in general. In general, the adolescent and even young adult is trying to understand the world and his place in the world, just like he's at an earlier age, has endeavored to understand his place within the family system. At times, this emotional and psychological pain can be so difficult that it can be very overwhelming and it can overtake the person's daily functioning. It can be difficult sometimes to even differentiate this emotional psychological pain from physical pain. And indeed, pain is always neurophysiologically based, even when initiated by external stimuli. It is literally painful to feel lonely, misunderstood, abandoned, empty, confused, embarrassed, and not in control of your own decisions. So it's important to never discount a person's perceived level of physical or psychic pain. The parent has to really try their very best to place themselves in the shoes of the borderline child. And it's hard, right? Let's say it's a medical issue. Let's say your child has eczema, which is eczema is a inflammation of the skin, and it can cause all sorts of terrible issues, including itchiness and redness. The child will scratch and it causes bleeding. And the child often at school or at summer camp or wherever can be very self-conscious, and it can create all sorts of issues. The child may only want to wear very long sleeve shirts, for example, to cover as much skin as possible, or even gloves. And the parent tries to be sympathetic. But imagine if it was you going to work every day or doing whatever you do on the weekend as an adult, and you can't show your legs or you can't show your arms or maybe your hands or your neck area or your face is discolored because of this dermatitis. It's difficult for us to place ourselves in the shoes of someone else who has a physical or biological or medical problem. And it's all the more difficult for us, particularly as parents, to understand what the adolescent is going through. It's very interesting. I always remark with parents that, when you're an adult, you can understand the difficulty of understanding what a geriatric or someone very old is experiencing because you have not been a geriatric. You have not been very old when you're 20, 30, 40, even 50. But we've all been children and we've all been teenagers and we've all struggled with those issues. And yet it's sufficiently distant enough in terms of time and sufficiently emotionally different, far away, that we can no longer necessarily properly either understand or empathize with what our child is going through, and particularly a child with a serious issue such as borderline personality disorder. There may be different ways for the child to contend with the borderline issues and his psychic pain by psychological and emotional cues that the parent should be aware of, including crying, increased confusion, irritability, distress, and agitation. You can observe this with the borderline child in different ways, with perhaps the child displaying rigidity, tension, fidgeting with hands or fingers, restlessness, increased pacing or rocking. Your child may have changes in activity patterns, such as the child may be more aggressive, pacing, rocking. There may be more disruptions in the child's daily life. The child may be more physically and emotionally withdrawn. There may be verbal and nonverbal complaints that your child is making, including grimacing, moaning, crying out, or cursing. Psychic pain is often the borderline's lifelong companion, and it can leave the borderline feeling breathless, unable to breathe. Psychic pain robs the borderline of psychological and emotional energy. Pain can also prohibit your child from cognitive processing, and even total confusion may occur because it's not possible to think through situations or anticipate danger when pain is overwhelming. Staying healthy requires hard work, may even be a full-time job for those with chronic physical pain, and the same is true for those who may suffer with chronic psychic pain. Behavioral and cognitive dysfunction cause pain, and pain can cause behavioral and cognitive dysfunction, which often feeds into the borderline's poor sense of self-preservation. And that's the next thing I want to talk about today. So we're going to be very cognizant as parents of the borderline psychic pain, and we're going to look for cues, because some of these cues are outwards expressions of the child's pain, but also ways that the child may wish to defend himself from pain, and it may also serve as indicators or cues for the adult, for the parent, for the caretaker, where the child is saying, I'm in pain. I may not have the vocabulary for it. I may not be able to explain it. I may be very confused. But these are indications of what I'm experiencing. One of the results of this psychic pain is that the child may have a poor sense of self-preservation. Now, generally, children have a poor sense of self-preservation. They can be impulsive. Children ride their bikes very fast. They engage in sports and activities that can be very risky. And it's because children don't have a sense of necessarily dying or worried about terrible injuries. You see children all the time that have broken their arms or their legs, and they sort of slough it off. They think, okay, so I'll be in a cast for 6 weeks. When you're 50 years old or 60 years old, and you break your hip or you break your leg, it's extremely debilitating, and the recovery time may be substantially longer, and sometimes you may never really fully recover. While children in general may not have a great sense of self-preservation, going with their toboggan, 90 miles an hour down some crazy hill with rocks that seems to go off a cliff. This is particularly true for children and young adults with borderline personality disorder. It's not just that the borderline child has a tendency towards self-injurious behavior, which is extremely important, and hopefully we'll have a video on it, but he just seems to have a limited ability to meaningfully distinguish between what is generally helpful for him from what is generally unhelpful and even dangerous or unsafe. The borderline seems less concerned or aware of such dangers or life changes, not necessarily because he wishes to cause himself harm as such, but the parent should be aware that the child's radar system, the child's ability to distinguish between safe and unsafe, seems to be less sophisticated. Rafting down a river's rapids requires basic self-preservation, avoiding dangerous rocks jutting out from the river, though everyone gets a thrill from occasionally bumping into rocks. But maybe the borderline can't really steer clear of the rocks at all, and may even enjoy being thrown from the boat. Without a good sense of self-preservation, the borderline is always in harm's way, resulting in a need for pity party. In other words, the borderline has the psychic pain, for which he may have cues to indicate to the parent. The borderline then also has a poor sense of self-preservation, again, very much indicating that he needs substantial guidance from the parent. But at the same time, the borderline throws a pity party due to his perceived victimization. And that's what I want to talk about now. Um, the pity party mode is about constant complaining about victimization, and it causes the borderline child to have very self centered thinking, and it reinforces negative bias about growth and healing, and increases the risk of depression and anxiety, and it prohibits personal responsibility and is anti motivational. These are several key points because one of the things we want from our children, particularly as adolescents, but even earlier, we want them to begin to take responsibility for themselves in a very daily, practical way to clean themselves, take care of their laundry, food. They know how to travel by themselves and undertake increasingly more homework by themselves to engage in healthy activities like reading and sports and so on. And this is a problem for those who claim constant victimization. They don't take responsibility for their lives in a healthy way. And the other thing I mentioned is that it's anti-motivational. You want your child to be motivated to do good things. You want your child to be motivated to do well on tests, to do well in their hobbies and activities, to maybe think about a career or college or whatever. But if you're always claiming that you're a victim, it not only removes responsibility and responsible behaviors and decision making, but it kind of kills motivation at its core. And that's very dangerous for borderlines because you want to have your child move forward in a healthy way, and particularly a child who has any kind of disability or limitation so that they can recognize it and overcome it through family support, therapy, and so on. But the borderline tends to pity himself. He wallows in his own sorrow. He may say that he's very marginalized and his life is terrible and hopeless and helpless. And it may also direct the borderline to reject help that's offered. It may direct the borderline to reject lifelines because if you get the lifeline, if you get the support, then you have to change your role and you have to change how you communicate with people, taking away the victimization. The borderline is reluctant to process emotions because they are threatening, right? And it causes anxiety. So he chooses to indulge in the pity party mode. It's a false emotional state, the pity party mode. It's not real. It's adopted. People don't pity successful people, so the borderline may proactively ensure that he remains in a pitiable position, at least superficially. Paradoxically, the need for pity may cause the borderline to set himself up to experience disappointment or failure, even abandonment or even abuse, particularly as a young adult in romantic and intimate relationships. This can occur when the borderline establishes unrealistic expectations in a relationship, necessarily dooming it to fail, allowing the borderline to make himself as a victim and then go into pity party mode. While an ordinary person may, dip their toe into relationships and slowly try to understand how one communicates and what kind of role one has with another, the borderline may jump into a relationship in an impulsive way, and this necessarily undermines the ability of the relationship to develop in a healthy way, so the borderline can ensure that they're in that victimization role, to ensure that relationships just don't work out. Parties require preparations, and invitations are sent out for guests to respond and show up. Similarly, the borderline's pity party needs a method to put others, and particularly their parents, on notice through various attention-seeking behaviors. And this is core for borderline adolescents, attention-seeking behavior, and the kind of attention-seeking behavior, by the way, that you would expect to find with children, perhaps, the ages of, let's say, 4 to 12 or so. But you see this with adolescent borderlines and young adults. The borderline may feign or exaggerate medical or physical symptoms, which is Munchausen syndrome, as a means to gain psychological or emotional support. And we see that, by the way, in factitious disorder sometimes. And it may even be a falsely assert that his child has a medical or physical problem, which could be Munchausen by proxy. And you see this with young adult borderlines that have children, or even, frankly, older borderlines that have children, where it's too difficult for them to assume the victimization or mantle of victimhood, in their 30s and 40s and throw a pity party for themselves because no one wants to feel pity for them at that point. And the older borderline that has children will say that that child perhaps has a medical problem, take that child to the emergency room, even though the child has no medical problem at all, but it's a means for the borderline to have the child evaluated, but also, in a sense, indirectly gain some sort of sympathy or empathy or understanding for the borderline's issues. Many borderlines have either been victims of abuse or perceive themselves to have been victims of abuse at various times. In the mind of the borderline, particularly at the unconscious level, the difference between the two may have little practical significance when it comes to the pity party. When the borderline has grown up in a middle-class home with all the attendant luxuries that one can objectively hope for, there may be little reason to pity him. In fact, some may view the borderline as terribly narcissistic and unappreciative of his childhood support system. This is very important for parents in, I hate to say it, but middle-class, upper middle-class homes. One of the things that we misunderstand with these borderline adolescents and young adults is that they're simply narcissistic and self-centered. And there may be a piece of that with the borderline child, but it's a specific constellation of symptoms, a specific issue that we're missing. We think that the child is just darned spoiled, and in fact, it's masking a more serious psychiatric issue. Just because the child lives in what appears to be a healthy middle-class home with a white picket fence around it, it doesn't mean that abuses have not occurred in the home. Similarly, just because the child every day goes to a good school and appears to have decent friends and the child's involved with maybe sports or art or music, doesn't mean that in the child's internal world, the child is not suffering terribly. Finally, sometimes someone can be both a victim desiring pity and a victimizer at the same time, perhaps because the person uses cognitive dissonance or compartmentalizes his experiences. That is, it's possible for the borderline to be manipulated by others, truly deserving pity, while also being horribly manipulative towards others.